Throughout this programme, you'll get to hear from our Group Consultations clinical lead, Dr Niti Pall, who is an experienced GP that established and ran group consultations in her surgery. She'll be sharing her insights and practical strategies to really help you set yourself and practice up for success. So let's see what Dr Niti Pall has to share about starting the group consultations journey.
I'm just a GP like most of the people that are trying to do this. So I started off life in an inner city practice in Sandwell, a very deprived population that I was looking at. And 15 years into my journey of looking at this cohort of patients, I thought, well, it's the same patients that keep coming back. What am I doing wrong as a GP, as a practice, that I really, and also I couldn't answer the question about whether we were really making a difference to the health of our populations. I know individual patients, you touch lives and you make people better, and that's the reason we are here. But also in a sense, we're a practice that looks after a population. We registered populations. Were we really using our registered population lists better is what prompted the questions about why we did this. And then just really embarrassed about some of the patient surveys that were coming out. It was, we all think we do a good job when we're sitting there in that consultation in our practices. But when patients can't get to you and they can't access you, and all the pressures that we currently have made us think about how this could be different for us. How could the experience be different for our patients? How could we be different for our patients and lead to better health outcomes and cost the health service less? So that's where we came from, to start to address a bigger problem, and group consultation was one of the tools that we came to. But really, it was just born out of an ordinary general practice that wanted to do better for their patients. And I'm sure that's where most people are. I think we'd come to a point where a lot of people with chronic diseases and other illnesses were walking in again and again. And I didn't feel that we'd given them enough time to really get to the bottom of what the trouble was. And I've thought that group consultations was probably a good way of starting to re-look at how you treat chronic disease and giving people more time to talk about their problems, interact with their peers, seemed to be a good way to start to proceed. That's why we did it. So the outcomes on care and patients on doing group consultations was quite profound, actually, and we didn't start to see this right away. The one thing on care was patients absolutely loved it because they had more time with us. So patients often will complain they didn't have enough time to talk to their doctor or to their nurse to really get to the bottom of what their illness was really about. So on their care continuum on the whole, I believe it really made a huge difference to them. And on outcomes, when we tracked outcomes, and we were quite careful about doing that at the start, we're starting to look at what, especially for diabetes, we looked at what their weight was post-consultation, their BMI, the body mass index, what their hemoglobin A1C was, which are all biometric markers of whether their condition is actually improving. And we did an evaluation about 3 months after a consultation, then a year on as well. And we found that the effects were sustained, and we found a reduction in weights, we found a reduction in BMI, and we found a reduction in hemoglobin A1C against a control group that hadn't been through the group consultation. So we believe both in terms of the experience that the patient had and as well as the health outcomes that we were starting to see was really quite profound. And again, the practice gained quite a lot from group consultations. It wasn't apparent when we first started doing this, and the efficiencies were really on utilization rate, so how often patients came back. So while we found a reduction in the number of times that an individual patient then actually came back to the practice to maybe ask similar or different questions because they hadn't been asked the first time round. And almost in the first year, we found a reduction of nearly 18% in utilization rates. And with the kind of pressures that practices are under now, I believe that this is so significant that you can't afford to ignore it now. I think what you could stop doing is doing routine reviews for everything. So really starting to look at who these patients were. And I think we changed as we started to do these more and more. We realized there was much more value in finding who the patients were who were using services and for what reasons. So we stopped doing routine reviews and calling them back for routine reviews, because the routine review actually happened in the group consultation. So they were able to have their whole condition dealt with. Their annual review for diabetes, for instance, was dealt with in the group consultation, including having their blood tests, seeing the nurse, talking about their medicines, having the prescription refilled. All of that was done in one go. So we didn't need to do an annual review for their diabetes again.